We're going to record today's session. And Cynthia, you can take it away whenever you're ready.
Excellent. My name is Cynthia Engel, and I teach psychology at Central Washington University. I'm also a program director for the Interdisciplinary Studies Social Science program. And I was a Central Washington University student. I graduated in 2009. And so I'm also a trained psychotherapist and a trained substance abuse and dependence professional. So I'm here today to kind of talk about the two big problems that people seem to be experiencing within quarantine, within stay at home, within COVID-19, which is anxiety and depression. How to cope with some of those feelings if it's the first time you've had them, and how to help other people if you see these things coming up within other people. So I'll start with some statistics. I'm gonna move you guys over here. There we go. Everything is increased a lot. People are feeling their feelings a lot more strongly, a lot more intensely than they typically do. So anxiety went up from 2019 to 2020 from 8.1 to 25.5, up 3 times. Depressive disorder went from 6.5 to 24.3% of people reporting symptoms in 1 year. And suicidal ideation has also gone up twice. So 4.3 in 2018 to 10.7 in 2020. So these are people who may have experienced anxiety and depression before. They may be people who are experiencing them for the first time and kind of are caught off guard by what this feels like and what to do about it. And so that's what we're here to talk about today. One thing to keep in mind is that anxiety and depression can occur at the same time. Some people experience them at the same time. They can experience them separately. So keep that in mind as we talk. So what is depression? I'm going to give you the clinical definition, which is really dry and boring. And we're going to talk about what does it actually feel like. So we talk about things like feelings of hopelessness, restlessness. A big indicator of depression is something that you've always loved and something you've always been really passionate about. All of a sudden you could care less. You don't want to do it. The people that you usually want to hang out with, you don't want to hang out with. It affects your sleep. You're getting too much or too little. So these are like classical diagnostic criteria, but what does that feel like? So as I studied existential phenomenological psychology, so we looked less at what is it, and we looked at more what is the subjective experience of the individual, which is a really great way to find out and to see what that is. So we're gonna go to my favorite blogger and artist and mental health advocate. Her name is Brosh. She has a blog, or she had a blog called Hyperbole and a Half. It was a best-selling book on the New York Times bestseller list, I believe in 2007. And she just published again this week. So I haven't seen her new book. I'm very excited. She explains mental health in a way that people have a visceral reaction to. I'll start really quick with my own experience of like discovering her. I had finished grad school as a licensed psychotherapist. I knew all the diagnostic criteria for all the mental health disorders. And it was about 6 months after graduation, and all of a sudden, I couldn't get excited about anything anymore. And I looked at the list and I'm like, I can check all the boxes, but I'm not depressed. I mean, this is not what depression is. And when I read her comic strip or blog, it fell into place. That's not what people think, and it can sneak up on you. And so once I kind of recognized it through her words, I was able to get some help and talk to some people. So let's start with, it's not necessarily sadness. It's being numb. You can't get excited about anything. You can't get sad about anything. You feel like a computer. You feel like a robot. Everything feels flat. So birthday technically feels the same as spiders in your hair. Everything is identical, almost like Groundhog's Day. In the day-to-day which we're clearly experiencing every day during COVID-19, right? I mean, people have talked about it being like Groundhog Day, or I know that there's Russian Doll is another show that talks about experiencing the same day over and over again. You don't have energy to do anything. You know what needs to be done. You can look around your house, you can look around your life, and you can say these things need to be done. There's absolutely no motivation to do anything. Not to see friends, not to clean your house, not to do your work. It's very, very hard to even imagine an idea that what's the point of getting up in the morning? It's just gonna be the same day. You sleep too much, or you can't sleep at all. This can look like not being able to fall asleep, which is what people typically think of when they think of insomnia, but an almost even harder one to tackle is waking too early and then not being able to fall back to sleep. And then even when you do get to sleep, it's not restorative sleep. You don't wake up feeling refreshed and ready to go. You wake up feeling, what's the point? Again. This is a big one, and this is one that I experienced during that time. It's hard to relate to other people. It's really hard to relate to other people because your brain isn't telling you emotional reactions to have to things, and so you're flat with other people and you try really hard to hide that, and hiding it can be really awkward. So all of these things, let me see, you become frustrated, you become irritable, things that normally would never bother you or you would just blow off as nothing become acute, razor sharp irritants. And we don't really think of anger or frustration as being part of depression, because depression's sad and depression's, gloomy and melancholy, but depression's angry and irritated too. So if you feel like, if people around you feel like they're walking on eggshells with you because you're irritable, that can be another sign. So everything we've talked about so far is something that's naturally occurred to everybody since the beginning of COVID-19. The COVID-19 has technically put us into a state of, we can't do the things that we love to do. Nobody's sleeping right, because nobody, I don't have anything that I have to get up for, so therefore I'm going to sleep till 2. We're eating differently than we normally do. We're sleeping differently than we normally do. We don't get the oxytocin rush of hugging someone. So all of the things that all of us are being presented with COVID-19 are technically diagnostic criteria for depression. So keep that in mind as we talk. Technically, you might not be depressed, but if you're feeling these things, there are coping mechanisms that we can talk about. So, anxiety. Everybody feels anxiety. Anxiety is an important part of life. If we didn't have anxiety, we wouldn't study for tests. We wouldn't practice for job interviews. We wouldn't get butterflies in our stomach when we hold hands with somebody for the first time. Anxiety is fantastic because it puts us in a little bit of a fight or flight. It gears us up for action. And depending on the context, it can make us feel really amazing or really terrible. So restlessness, nervousness, feeling overwhelmed, trouble concentrating, again, sleep problems are common with both depression and anxiety. Avoiding people or places or things that trigger that. And then physiologically, anxiety looks really much the same if you're holding hands with somebody for the first time or going into a job interview. Your heart rate increases, your pupils dilate, your breathing increases, your blood pressure increases because your body's going into fight or flight. The only reason that we know the difference is because the context of the situation that we're experiencing it in. It feels great to have those things when we are in love, and it feels terrible to have those things when we're nervous about something. So anxiety, but what does it look like? Anxiety is a strong feeling in your gut for some people, in your chest for other people, that something really bad is going to happen. A feeling of dread, and it's pervasive. And there was nothing, you're not worried about anything in particular. It's not, is there going to be an earthquake, or is there, is this going to happen, or is that going to happen? It's just kind of this low grade feeling of dread most of the time during a 2-week period. So something's going to happen. You don't know what's going to happen, and you have no reason to think so. Racing thoughts when you're trying to sleep or you're trying to concentrate. So laying in bed at night and not even worrying about one thing, but it's almost like a film going in your head that's like, and your brain will not shut down enough to allow you to sleep. So this can happen when you're trying to fall asleep. It can happen in the middle of the night when you wake up and you can't get back to sleep. So anytime that you were trying to do something and these feelings of dread or doom or something bad's going to happen are getting in your way. Being really hyper aware of your surroundings and taking steps to avoid anxious situations. We think about this a lot in like post-traumatic stress disorder, right? We think about this hyper alertness, hyper awareness of everything that's going on, but we're all very, very sensitive to our surroundings right now. Is someone wearing a mask? Someone at QFC is not wearing a mask. You know, being hyper aware of germs right now, being hyper aware of being around other people, and that idea of having our society right now is infectious, and that's really, really frightening. So people who are taking steps to not go out at all, even if it is considered reasonably safe to go do something. So for example, going grocery shopping while wearing a mask and sanitizing your hands is considered pretty safe. You have to be with someone for a certain period of time who has contagious and is shedding virus. So taking too many precautions and being too hyper aware can be one symptom of anxiety. You're always in fight or flight. This is Brosh's. This is what she says. This is her pain scale. She said the pain scale that they give at the doctor's offices aren't accurate. You need to be more specific. You're in fight or flight. You're always amped up for something to happen. Sometimes this can be being very, very, I don't want to say panicked, but becoming really unsettled if the phone rings. Who's on the phone, or having things that are not expected or spontaneous pop up puts you into this fight or flight, higher blood pressure, increased pulse rate, increased breathing. So some of the things that you can do are clinically validated. Some of the things that you can do are things that are anecdotal, that I've heard from other people, that I've experienced myself. So we're going to talk about what you can do on your own, but we're also going to talk about at what point is it time to stop and say, I need help. I need some help. I'm not doing well on my own, and I need somebody else to step in and kind of walk me through how to do this. And so what can you do? This is my favorite quote of all time by Brosh. All right. Because people say, well, you can just change your mind about how you feel. I mean, come on, you're doing this to yourself. I actually had a dental hygienist tell me that one time when I was in, that my anxiety was so high. And she kept saying, you're doing this to yourself. You could stop if you wanted to. You just need to change your mind about how you feel. And this is the best response to that. Trying to use willpower to overcome the apathetic sort of sadness that accompanies depression is like a person with no arms trying to punch themselves until their hands grow back. A fundamental component of that plan is missing, and it's not going to work. You can't wish your way out of it. You can't just decide that you're not going to be sad or depressed or unhappy or anxious. Our bodies either work really well or they don't work really well. And if you think of depression or anxiety kind of like other disorders where your body's not regulating itself well, your pancreas isn't working, it's diabetes. You take medication, you get back on track. It's a big deal, but it's manageable. Thyroid disorder, these are things that your body's just not doing what it's supposed to do, and you need a little bit of help. And sometimes that help is short-term and sometimes it's long-term. So when we're talking about what to do, keep in mind that this is your mind, but it's also your body. And taking care of both is very important. Come on. There we go. All right. So what if you're emotionally uncomfortable? So we're not going to say depressed. We're not going to say anxious because those are clinical diagnoses. We're going to say if you are emotionally uncomfortable right now and it's really, really, really new for you, you don't know what to do. There's a stigma about mental health disorders. You need to think of someone in your life who is open about talking about their own stuff. They don't carry a stigma. They don't carry any judgment about anxiety or depression or, things like that. They're really, really open about their own emotions and they're able to show empathy. You want somebody who's not going to try to jump in right away and try to solve it for you. Because most of the time, what people need is somebody to just hear them out. Being heard is much, much, much more important than being advised. Much more important. Keep reasonably healthy food that's easy to prepare in your house. If you have no motivation to do anything and you also have nothing in your kitchen, not only is your brain having problems and your emotions are having problems, all of a sudden you don't have anything that's going to give you enough energy to do the things that you actually have to do. So keep food in your house that you can just as a go-to, not junk food, but I'm not saying keep kale and but keep something reasonable. Protein bars, granola bars, something that you can just go grab if you are unmotivated to cook, and make sure that they're in your house. And keep in mind, I just actually started doing this and it's kind of awesome. Have something delivered. Have your food delivered to you. If you're anxious about going out, that's normal right now, and but you still have to keep your kitchen stocked. It doesn't cost, I think it's $10 to have Safeway deliver or Fred Meyer. So have it brought to you. Think of this period of time as like an emotional flu. What we're going through right now is like an emotional flu, and you need to ask for help, and you need to find ways of getting help when you need it, and you need to take care of your body, and you need to give yourself a lot of patience and a lot of room to experience this and know that it's going to be okay eventually. So take your multivitamins, talk to your doctor about vitamin D supplements. In the Pacific Northwest, we are chronically low on vitamin D. And vitamin D is a supplement that can help kind of stabilize mood. I know people who are on like 800 milligrams of it because they are so desperately low on vitamin D because of our lack of sunshine. As far as sunshine, get outside when you can. Don't run a marathon. Like, don't decide, I'm going to run a marathon because that's going to make me feel better. Get outside and sit on a chair. Get outside, take a book outside. Find a place where you can see the sky, where you can feel that there is a world outside your house. Because sometimes being in those four walls for a long period of time, you forget that there's something bigger than you outside. And so I'm not saying, go outside and do yoga in your backyard. Just be out in the world in fresh air. This is a really big one. It's my kid. He's getting this information too. Don't skip showers. Don't stop taking care of your body. I think everybody knows what it feels like to skip a shower for a couple days when you're not feeling good. And the minute you take a shower, it may not help with depression, it may not help with anxiety, but my gosh, you're functional. You just feel better when you are taking care of yourself. Put clean clothes on. Take care of your body. Don't let it suffer because you are having a really hard time, because it will absolutely help. And be really kind to yourself. Understand that it may be a permanent situation that you're going to deal with for your whole life. But for right now, if it's the first time you're experiencing it, look at it as, this is part of what we're going through. It's happening to a lot of people right now. And there are people out there who are more than happy to sit down and talk with you about it. Do you guys have any questions yet? I'm going to pause really quick. Any comments?
You said something, I actually wrote it down. You said being heard is much more impactful and important than being advised. That is something that I often do. I have to really work it, not giving advice of how to move forward.
It
Or do
is so hard not to. Because we
um,
want, it's not that you're trying to be, I know everything, and you want to help so bad. It's so
yeah,
painful to see someone you love hurting. So you want to come up with a solution for them. And
yeah,
you want to help them. And during that period, they can't hear that, right? Or, well, we'll have a slide on it in a little bit. But yeah, you being heard, being validated is enormous.
I wrote it down.
Good.
Thank you.
But I'm telling you, I understand it is tough. That's one of the things that when I was learning to be a therapist is having to pull back from that. Oh, I have some really great advice for you. You should do this, and just say, let the person process through it themselves and tell you what they want to tell you and talk about what they want to talk about.
Good listener, I know.
So when should you be worried? Or not necessarily worried, but when is it time to just say, you know what, I'm not doing so hot, and I think that maybe help would be a good idea. So if these symptoms are new to you and unrelated to events in your life, now that's what we typically would say. For a lot of people, this is new to them. It's related to our new situation. And so this one, typically it's related to what's going on. Isolation, worry about our future as a nation, worry about our future as a world, worrying about the future of our family and the health of our family. So if those are tied to COVID and our specific circumstances right now, that's pretty normal. But what you want to look for is it out of proportion? So for example, when we lose someone that we love, we're going to go through a grieving period. Everyone goes through a grieving period. They go through a period where you just feel horrible and you miss the person and your heart is broken and your gut is a mess and you just want them back so bad. And it's really normal to feel like that for a while. But if 6 months later, you haven't started improving and you're still feeling that same ache and that same gut, talking to somebody might help. So look at the proportion. If your emotions are here and the situation's here, it's time to start thinking about reaching out. Symptoms persist intensely for more than 2 weeks. And this is the biggest one because this is all subjective. Some of us can handle a lot before we get to the point where we're ready to throw in the towel and say, I need help. If they're creating problems with your daily functioning, if you're having a hard time getting up and going to work, if you're having a hard time getting up and going to school, if you are having a hard time doing things that you normally really just kind of do automatically, and all of a sudden you are having a hard time, it's causing problems for you, maybe with your work, with your partner, with your professors, that's when you really, really need, and that point is going to happen at different times for different people. And the big one is if you're feeling hopeless or like you want to harm yourself. That is automatic, get help right away. There's no point in living. I can think a lot of times when I wake up in the morning, what's the point getting out of bed? Because, again, Groundhog Day. But if you're feeling hopeless about life, you see no future for yourself, you feel like you're a burden to others, that's when it's really, really important to step back and say, someone else needs to help me drive this for a while. Okay, so people who can help, your primary care physician is a fantastic person to start with. They can point you in the direction of maybe getting help with medication temporarily, or they may point you into working with a professional. So a professional would be a psychotherapist, or sometimes social workers also work as a psychotherapist. They don't prescribe, but they do provide an outlet to talk about how you're feeling. And again, being heard, really big. Saying it out loud to another person is enormous. Having someone who is not going to be judgmental, who is going to be a vessel for all of your feelings, and you know that they're strong enough to hold on to it. They're strong enough to listen and to be there as a place where you can bounce your thoughts and feelings and ideas off of. Psychiatrist is someone who typically prescribes medication. Psychiatric nurse practitioners, again, is kind of a combination between a therapist and a psychiatrist. They provide therapy, but they can also prescribe. If you need immediate attention, and I was intending to contact the King County Crisis Clinic to get this list, and I completely forgot, but I can send that out. A crisis hotline for immediate contact with someone who will listen with no judgment or unwanted advice. So I worked for the King County Crisis Clinic for a long time, and people think, well, that's a suicide hotline. I only need to call that hotline if I'm like, ready to hop off a bridge. And it's not. 90% of the calls that we got had nothing to do with suicide. The people weren't suicidal. They lost a spouse. They were overwhelmed with grief. They just wanted to talk to somebody that wasn't their family. People experiencing substance abuse, and we're just looking for someone to kind of sit through that with them and maybe help them think about what their next steps would be. The people who work at crisis hotlines aren't necessarily therapists. I had a Clinique counter, makeup artist sitting next to me on one side and an architect on the other side. They're not therapists typically. They're people who are so well trained at listening and hearing, and then knowing when to be alarmed. So yeah, don't think of a crisis hotline as a suicide hotline. There are suicide hotlines, but a crisis hotline typically is, you just need somebody to hear you out for 10 minutes. And if that will help, then absolutely utilize them. They're also, if you are like, hey, you know what, that would be a really great way for me to spend my time right now. Definitely look and see if there are opportunities, if that's something you want to do. Volunteering always feels good. Helping other people always helps us as well. So how to help others. We're going to talk about suicidal ideation first, because I think that I don't want to end with this because it's kind of, hard. It's hard to talk about, and it is something that needs to be addressed. So, you're looking for this in other people, in yourself. One of the first things that we had to learn when we were at the King County Crisis Clinic is how to actually open your mouth and say to another human being, are you thinking about killing yourself? Because those words are almost impossible to say without feeling like horrible. You feel like you're giving the person the idea. And trust me, that's not the way it is. You want to watch for words, feeling hopelessness, a burden to others, now there's no reason to live. You want to watch for behaviors like increased alcohol or drug use. Well, clearly we're all withdrawing from friends and family right now, but withdrawing from friends and family in a way that's atypical for right now. So not texting, not calling, not texting, shutting down other people from your life. And a big one is giving away possessions, giving away prized possessions to people. And then this feeling of, that goodbye that they gave me on the phone felt really different than any other goodbye I've ever had. I'm a little bit concerned that something's going on. And then moods, you want to watch for loss of interest, irritability, humiliation or shame. The one that you don't think about when you watch for moods is the idea that sometimes people will all of a sudden seem a lot better. They'll improve, their mood improves. And this is particularly problematic because a lot of times what this means is that they've made a decision. And so they're not, mulling it over in their head anymore. It's like, okay, I've made my decision, and everything kind of lightens up, and that decision could be that they're going to end their life. And so you really, you want to watch for that as well. If you think somebody might be suicidal, you need to ask them straight up. Are you going to kill yourself? Is this something that you're thinking about? Be direct. Don't say, you're not thinking of killing yourself, are you? The words need to be clear. They need to be direct. You're not putting an idea in their head that's not already there. Most of the time, 99% of the time, if you ask them to this, they're like, oh, no, I'm just having a really hard day. But gosh, if they are, and you provide them an outlet to talk about it, you can save their life. I've got some red flags listed on the following page. If you see these red flags in people and you really, really think that they are an imminent risk, you need to ask them to call 911. Could you call, I think that you could probably use some help and I'm really, really worried about you. I would like you to call 911. Can you do that for me? If they don't want to call themselves, ask them. I mean, you're trying to include them in the decision process as much as possible because you don't want to bulldoze people. If they don't want to call themselves, ask, can I call for you? Can I be there with you when the emergency services show up? If their responses to, do you have a plan? Do you have access? How lethal is your plan? And do you have a support system? If those are all like high risk, you need to call even if they don't want you to. You give people the choice for a certain period of time, but if you are truly convinced that this is imminent, you need to call 911. But typically when people are feeling like this, they're still not quite sure that this is what they want to do. So you want to ask, do you have a plan? A plan would be a time, a date, a method. No plan, no risk. A lot of times suicidal ideation is like, oh, I have this in case of fire, break glass scenario that if it gets really bad, I'll get to it, but it's not anything that's happening right now. Do they have access to their plan? So, well, if someone mentions, a gun, do they have a gun? If they don't have a gun, you don't have to worry as much right away. You still need to be concerned. So you think about how close are they? We used to tell people on the crisis clinic, if they, for example, had a gun or if they had pills, we would say, here's the deal. You having those right now are making me really uncomfortable because right now what we want to do is talk and I want to be comfortable. So could you take those and just put them in the glove compartment of your car? Shut your car, come back inside, and then we'll talk. Because I just want to know that for the time being that you're safe. So if they have access, get them away from the access. If they don't have immediate access, they're lower risk for sure. How lethal is their plan? Guns, ropes are lethal. Those are red flags. Those are instant. You cannot walk back from those. If someone answers, overdose, I'm going to take pills, yellow flag, simply because those take time and there's time to get 911 and emergency services to them. It also gives them time to say, you know what, I changed my mind and back it up. And if this is a person with no support system at all, you really want to be more concerned than someone who has lots of friends and family that they can turn to. Any questions at all? It's tough to talk about. It really, really is. But it is necessary to become somewhat comfortable with the idea of confronting someone about this. So here's what we were talking about. Words are more important than, what did I say? Being listened to is more important than being advised, right? So don't try to make it better with words. You're not going to be able to help them in the moment with words. So no silver linings. I love this piece of her cartoon. This is some weird game that you name all the things that I can't do. So no platitudes. No, God doesn't give you anything you can't handle. No, they're in a better place. Don't downplay it. Don't try to make it like, oh, this is actually a good thing in the long run, because that's not going to help right now. Don't compare them to other people. Don't compare them to yourself. Don't say, I've been through this and I don't understand why you're having such a hard time, or so-and-so is going through something even worse. And you just seem like you're overreacting. No shaming or blaming. I told you so is not okay. Or you put you got yourself where you are right now. You don't have anyone to blame but yourself. So shaming or blaming or minimizing their feelings isn't going to help. It's, you know, when we want so badly to help, and we want to make it better with words, and it just doesn't happen. It just does not happen. Try these magic words instead. That sounds really hard. Do you want to talk about it? And then just let them go. Let them talk and listen and listen and listen. This is what people need when they reach out to you and they say, I'm having a really hard time, or I'm going through this thing. That sounds really hard. Tell me about it. Talk to me about it. I'm listening and I really want to hear. Is going to help more than anything. That sounds really frustrating. That sounds really scary, whatever the situation is. Showing that you are listening and you are interpreting their words as something to be alarmed about or concerned about, so that they see that you are concerned and that you are listening to what they're saying. So the most important thing that you convey is that you're present, that you're patient, you're not in a hurry. I've got all the time in the world. I'm here for you if you need to call, and that you care deeply about them. Those are the things that you really, really want to let people know when they come to you and they tell you, I'm not doing so great. And right now we're not, as a society, we're not doing so great. And individually, we're not doing so great. It's okay to not be okay right now. It's okay to be frustrated and angry and anxious and numb about all of the things that are happening in our world, because they're new to everybody. None of us know really how to react. So keep your eye on yourself, take care of your body, take showers, eat good, and keep track of your friends and neighbors. And if you think they're going through something, then it's a good time to just give them a call. So that's it, I think. Any questions?
Information.
Really good information.
Awesome.
Thank you.
It helped me understand more of you know, not just the person I live with, but you know, others in my family and what they're dealing with and what they're going through.
Yeah, you know, a lot of people think depression looks a lot like grief, where it's sobbing and, you know, going in your room and shutting the door and turning off the lights, and that could be depression, definitely, but it could also be grief. Depression typically is when all of those feelings go away and there's nothing.
Yeah.
And that's what's really frightening, is that feeling of, this is how I feel and it's never going to change. I don't see any way out of this, is when we start to look at that as clinical depression. Another thing that you can do, and this is something that I am super comfortable doing just because, you know, I'm a therapist, but I've, you know, to destigmatize the idea that mental health means that you are weak. Mental health means that there's something wrong with your brain, or that you weren't raised right, or whatever. And I'm very open to saying, hey, you know what? I have been anxious for about 20 years, general anxiety, and I have had depression on and off for about the last 7. And I have a great psychiatric nurse, and I'm on medication, and it makes me feel better. And that's okay, right? It's okay for me to say that, in the same way that someone says, I am diabetic, I have to take medication, and that's going to help save my life, and it's going to help me in the day-to-day. So looking at mental health as something not to stigmatize, but something to share in a way that will help other people say, you know, it's okay. Like, I can do this. Trying to think if there's anything else. There's a couple things that I will get to you guys. One of them is I will get a hold of the King County Crisis Clinic. Every county has their own hotline. So, you know, typically I just give out the King County hotline because that's where I live and that's where I worked. But I will get a list of hotline numbers. Again, they're for anyone who just needs to get some stuff off their chest because it's overwhelming. There's also a really great graph that I have found. I couldn't find it last night when I was looking for it, but it's basically paying attention to what can you control and what can't you control, right? And being able to say to the things that you can control, great, I've got this. I cannot control whether or not people wear masks in the store. I cannot control whether people go to weddings in Delaware and infect the entire state. I have no control over those. And so I need, learning how to just recognize what can you control and what can't you control helps to alleviate some of that pressure of feeling like I have to do something. Do what you can. If what you can do is turning on The Haunting of Bly Manor on Netflix and binging all 9 episodes in one day, which I did, had nothing to do with depression. That's okay too. Take the time that you need to just be mindless, watch too much Netflix. So, all right, guys.
Right.
Job.
Thank you so